You've built a careful daily routine. You're proud of it. Almost every habit in it is quietly damaging you. Here are 51 of them. 1. You carry that giant water bottle everywhere, like a trophy, religiously tracking ounces because some rule you absorbed decades ago told you 8 glasses a day is the non-negotiable foundation of human survival. Here's the problem. That rule has no clinical basis. It came from a misreading of a 1945 U.S. Food and Nutrition Board recommendation that explicitly noted most of your daily water requirement comes from food, fruits, vegetables, even your morning coffee. But that caveat got quietly dropped as the rule spread through culture like a very hydrated rumor. A landmark 2002 review in the American Journal of Physiology found zero scientific evidence supporting 8 glasses as a universal requirement for healthy adults. Zero. And the other end of the spectrum isn't safe either. Overhydration, hyponatremia, is a genuine medical emergency where excess water dilutes your blood sodium to fatal concentrations. Endurance athletes have died from drinking too much water during races, not too little. Your kidneys can only process roughly 0.8 to 1 liter per hour, and consistently pushing past that strains your filtration system over time. Here's what your body actually gave you to solve this problem: thirst. It is a finely calibrated biological sensor. By the time most healthy adults register thirst, they're only mildly dehydrated. Not in crisis, not approaching organ failure, just mildly in need of a drink. Individual water need varies enormously based on body weight, activity level, climate, kidney function, and the composition of your diet. The idea that a single daily number applies equally to 8 billion genetically unique human beings with wildly different lives is not science. It's a guideline that lost its footnotes. You're not a houseplant on a watering schedule, and your kidneys would genuinely appreciate you treating them accordingly. 2. You sit up straight because every teacher, every parent, and every office wellness poster in your life delivered the same instruction. Shoulders back, spine rigid, 90 degrees at the hip, head up. You do it dutifully and call it good posture, and you have been doing real, cumulative damage to your back in the process. Forced perfect posture creates chronic muscular tension and is now directly linked to increased back pain, not decreased back pain. A 2006 study using upright MRI scanning, published in the journal Spine, found that a slightly reclined seated position of around 135 degrees placed the least compressive force on lumbar discs. Not the rigid upright position, not the military stance. 135 degrees, which looks, by most office standards, like you're being slightly lazy. The problem with sustained static posture of any kind, including the correct kind, is that the same muscle fibers fire continuously without rest, producing fatigue and eventually pain. The concept of one universally correct posture has been formally abandoned by most sports medicine and physical therapy communities since the early 2010s. What research from Cedars-Sinai and similar institutions now emphasizes is movement variety, changing positions regularly, not achieving a fixed geometric ideal and holding it indefinitely. Forcing your thoracic spine into an unnatural arc to perform straight also compresses the mid-back and measurably restricts your breathing volume, which is a strange trade-off for looking responsible. The military attention stance. The cultural gold standard everyone pictures when they hear good posture causes measurable muscle fatigue within minutes and was never intended for sustained use. It's a momentary ceremonial position, not a lifestyle. You have been clenching your spine like a fist for potentially decades because a grade school teacher told you to, and your back has been filing a formal complaint the entire time. 3. You finish a meal, feel like a responsible and hygienically conscientious adult, and immediately grab your toothbrush. It feels correct. It feels disciplined. It is stripping your enamel, brushing within 30 minutes of eating, especially after anything acidic, actively scrubs the softened enamel surface, accelerating erosion in a way that accumulates into permanent, irreversible damage. Acidic foods and beverages temporarily soften enamel, and the American Dental Association recommends waiting at least 30 to 60 minutes before brushing to allow saliva to remineralize the surface and restore its hardness. A 2004 study in the Journal of Dentistry demonstrated measurably greater dentin erosion in subjects who brushed immediately after consuming acidic drinks versus those who waited. The foods most likely to trigger this window are the ones you consume most frequently at breakfast and lunch: coffee, orange juice, soda, citrus fruits, and vinegar-based dressings. All of them. Your entire morning beverage routine is a pre-erosion event, and following it immediately with a toothbrush makes it worse. The critical detail that makes this particularly grim is that tooth enamel does not regenerate. It is one of the very few tissues in the human body with zero self-repair capacity. Once it's gone, and the damage is permanent and cumulative across every over-eager brushing session you've ever had. The saliva remineralization process relies on calcium and phosphate ions actively repairing the micro damage caused by acid exposure, and brushing interrupts that process before it can complete. Dentists increasingly recommend rinsing with plain water immediately after eating to neutralize surface acidity, then waiting the full remineralization window before picking up a toothbrush. You have been wire brushing a wet paint job every single morning because you thought you were helping, and your enamel has been getting measurably thinner the entire time. 4. Antibacterial soap sounds categorically superior to regular soap. The logic is right there in the product name. It specifically kills bacteria, and that is precisely the goal of washing your hands. You've been buying it for years, possibly your whole life, and the FDA removed its primary active ingredient from consumer products in 2016 because manufacturers could not prove it worked better than regular soap and because evidence of harm was mounting. The active compound in question, triclosan, was found to disrupt hormonal regulation in animal studies, specifically interfering with thyroid function at concentrations relevant to real-world human exposure. The FDA's ruling wasn't the result of a single alarming study. It came after a sustained multi-year evidence review that required manufacturers to demonstrate both safety and superior efficacy, and they couldn't do either. The mechanism of regular soap is worth understanding. It works by mechanical action, surrounding dirt and bacteria with surfactant molecules that rinse away during hand washing. Killing bacteria on contact during a standard hand wash adds no measurable benefit to that process. What it does add is the long-term problem of antibiotic resistance. Multiple studies demonstrated that regular triclosan exposure in home environments contributed to the development of resistant bacterial strains, meaning the soap marketed as your superior defense against bacteria was actively contributing to a future where antibiotics fail. Studies on the skin microbiome add another layer. Over-sterilizing the skin surface disrupts the protective bacterial ecosystem that normally outcompetes harmful pathogens on your own skin. Many products still carry antibacterial labeling using replacement compounds whose long-term safety data remains thin. You paid extra for a product the FDA pulled, potentially contributed to global antibiotic resistance, and disrupted your own skin's natural defense system, all in the name of thorough hygiene. 5. You crack your knuckles and someone nearby delivers the warning they've been holding since childhood. Keep doing that and you'll get arthritis. It has the weight of obvious biological fact. It is not. Knuckle cracking does not cause arthritis. This has been studied repeatedly, including by a researcher named Donald Unger, who cracked the knuckles of only his left hand for 60 years and compared both hands at the end of that experiment. He published his findings in Arthritis and Rheumatism in 1998. No difference in arthritis development between the cracked hand and the control hand. He won an Ig Nobel Prize for the dedication. The cracking sound itself is caused by the rapid collapse of gas-filled cavities, primarily nitrogen and carbon dioxide, that form when joint surfaces are pulled apart, a process called tribonucleation. A 2011 ultrasound study published in PLOS One confirmed this cavity collapse model and found no joint damage markers associated with the process. True arthritis results from cartilage breakdown, autoimmune responses, or uric acid crystal accumulation. None of those mechanisms are triggered by gas bubble dynamics in the joint fluid. The myth is so culturally embedded that it persists despite multiple clear scientific refutations spanning over 30 years of research. However, the story is not entirely consequence-free. Habitual knuckle cracking has been associated with mild soft tissue swelling in long-term studies, and a large 1990 study did find slightly reduced grip strength in people who cracked their knuckles habitually over many years. So it's not entirely without any effect. It's just that the specific effect everyone warns you about is not the one that actually occurs. The arthritis threat was always a bluff. The mildly annoyed person sitting next to you, however, remains an entirely real and justified consequence. 6. You sleep less to get more done. You've turned undersleeping into an identity, a performance, a proof of serious ambition. Sleep is for the undisciplined. You'll rest when things slow down. The CDC has formally classified sleeping fewer than 7 hours per night as a public health problem, and research shows that chronic sleep deprivation produces cognitive impairment directly equivalent to being legally intoxicated. Research from the University of Pennsylvania restricted subjects to 6 hours of sleep per night for 2 weeks, and found their cognitive performance matched that of people who had gone 2 full nights without any sleep at all. The part that should concern you most: those subjects reported feeling only slightly sleepy. They had lost the ability to accurately assess their own impairment. You don't know how badly you're functioning when you're chronically underslept, which makes every decision you make in that state worse than you realize. During sleep, your brain's glymphatic system, its waste clearance network, removes metabolic byproducts including beta amyloid proteins linked to Alzheimer's disease. Insufficient sleep means those proteins accumulate. A study in Nature in 2021 found that consistently sleeping 6 hours or fewer in midlife was associated with a 30% higher risk of developing dementia. Your immune function degrades measurably within 24 to 48 hours of sleep restriction. A Carnegie Mellon study in 2015 found that people sleeping under 6 hours were 4 times more likely to develop a cold when directly exposed to the virus. Cortisol levels rise significantly in sleep-deprived individuals, driving increased appetite, fat storage, and inflammatory markers. And the weekend catch-up strategy. The plan most sleep-deprived people rely on has been shown not to fully reverse the metabolic and cognitive damage accumulated during the week. You have been proudly running your brain at reduced capacity and calling it a work ethic, while your neurons have been quietly filing paperwork for early retirement. 7. You're in a quiet room, a meeting, a library, a solemn occasion, and a sneeze threatens. You clamp your mouth shut, pinch your nose closed, and suppress the entire event with admirable social composure. You have just redirected an enormous pressure spike into structures that were not designed to receive it. A 2018 case report in the British Medical Journal documented a previously healthy 34-year-old man who ruptured his pharynx, the throat, by holding in a sneeze. He was hospitalized for 7 days and required tube feeding. A sneeze generates internal pressure of approximately 176 millimeters of mercury. When you suppress it, that force has nowhere to go, and it goes everywhere it wasn't meant to. The eustachian tubes, which equalize ear pressure, are particularly vulnerable. The redirected pressure spike can rupture the tympanic membrane outright, causing immediate hearing loss. In individuals with pre-existing but undiagnosed cerebral aneurysms, the acute intracranial pressure spike from a suppressed sneeze has been identified as a potential rupture trigger in medical literature. Beyond the structural risks, the sneeze itself serves a direct immune function. It expels pathogens, irritants, and foreign particles at speeds reported between 100 and 200 miles per hour, actively clearing infectious material from your upper respiratory tract. Suppressing it doesn't eliminate the irritant, it just keeps it inside your airway. Worse, the forced suppression can drive infected mucus backward into the sinus cavities and eustachian tubes, potentially seeding a secondary sinus or ear infection from material your body was actively trying to expel. You risked your eardrum, your throat lining, and potentially a brain bleed so that a conference room wouldn't think less of you for half a second. The meeting genuinely was not worth it. 8. Your phone lives on your nightstand, inches from your head, because it's your alarm clock, your last interaction before sleep, and your first one in the morning. This is just modern life, and modern life is structurally sabotaging your sleep. The blue light emitted by screens suppresses melatonin production for up to 3 hours after exposure, and a Harvard Medical School study demonstrated that blue light suppresses melatonin approximately twice as powerfully as green light, shifting your circadian rhythm by up to 3 hours. That means your biology is set to a later sleep-wake schedule than your alarm demands, creating a permanent deficit between when your body wants to sleep and when your obligations require you to be functional. Melatonin is not merely a sleep hormone. It functions as an antioxidant and immune modulator. Chronically low evening melatonin is associated in epidemiological studies with increased cancer risk, particularly breast and prostate cancers. The World Health Organization classified night shift work, which produces similar circadian disruption, as a Group 2A probable carcinogen in 2007 based on this exact mechanism. The phone on your nightstand is a lower intensity version of the same biological disruption, repeated every night. Night mode and warm color screen filters reduce but do not eliminate the suppression effect, and the stimulating content of notifications, messages, and social media activates your arousal system independently of light wavelength. Phone proximity during sleep has also been associated with cortical hyperarousal. Your brain remains in a low-level alert state even without active notifications, reducing the depth of slow-wave restorative sleep. The most expensive piece of real estate in your home is your bedroom, and you have engineered it into a laboratory for sleep disruption and called it a nightstand. 9. A long hot shower is your daily reset. It wakes you up, soothes your muscles, and makes you feel like a functioning human being. It is also systematically stripping your skin of the lipid barrier it depends on for protection, moisture retention, and pathogen defense. And for most people in non-physically demanding environments, it provides no hygiene benefit that a less aggressive routine wouldn't achieve. The skin's stratum corneum, its outermost protective layer, depends on a lipid matrix of ceramides, cholesterol, and fatty acids to stay intact. Hot water dissolves those lipids more aggressively than warm or cool water, and daily hot showers prevent the barrier from fully recovering between sessions. Dermatologists at Harvard Medical School have publicly stated that daily showering is a cultural and social norm, not a medical recommendation, and that most people shower far more than skin health requires. The skin microbiome, a protective ecosystem of commensal bacteria that outcompete harmful pathogens, takes 24 to 48 hours to reestablish after a thorough wash. Daily showering prevents full recovery, leaving your skin in a state of chronic imbalance. Eczema, psoriasis, and contact dermatitis are all exacerbated by excessive hot water exposure, and dermatologists routinely prescribe reduced bathing frequency as a first-line intervention for these conditions. Body odor is primarily caused not by sweat itself, but by bacterial activity on sweat in specific areas. Targeted washing of odor-producing regions is more effective and less damaging than a full-body daily hot shower. Water temperature above approximately 47 degrees Celsius, common in many household showers, begins to denature surface proteins in the skin, causing microdamage that accumulates with frequency of exposure. You have been pressure washing your own skin barrier every morning in the name of cleanliness and then wondering why your skin feels tight, dry, and reactive. 10. You grab your sunglasses when it's visibly bright and skip them when it's overcast because you're responding to glare, and overcast days don't produce glare. What they do produce, largely unimpeded, is ultraviolet radiation. And the gap between what you can see and what is damaging your eyes is where this habit does its slow, permanent work. Up to 80% of UV radiation passes through cloud cover, according to the World Health Organization. Overcast conditions reduce visible light dramatically, while barely reducing your UV dose, which creates a consistent false sense of protection on the days you're most likely to go without glasses. The lens of the human eye accumulates UV damage across a lifetime with no repair mechanism, and this cumulative damage is the primary cause of nuclear cataracts, affecting over 24 million Americans over age 40. Macular degeneration, which causes progressive central vision loss and has no cure, is directly linked in multiple longitudinal studies to lifetime UV and high-energy visible light exposure. Reflected UV from surfaces like concrete, water, sand, and snow is particularly dangerous because it enters the eye at low angles that the brow and eyelids don't shade, making it more damaging than direct overhead sun in many real-world situations. Here's the detail that makes cheap sunglasses actively worse than no sunglasses at all. A dark lens with no UV 400 coating causes pupil dilation, which admits more UV light directly to the retina while providing zero filtration of it. You see less glare, your pupil opens wider, and more radiation reaches the back of your eye than if you were squinting in full sunlight. Your skin gets SPF 50, and your eyes absorb a lifetime of unfiltered radiation, and the lens of your eye has been keeping a running tab on every cloudless, cloudy, and reflected surface day you spend without protection. 11. You show up to the gym, unroll your mat, and spend 10 minutes performing static stretches before your workout. It is classic, responsible-looking injury prevention. Research has repeatedly shown it is the opposite. A comprehensive 2013 meta-analysis published in the Scandinavian Journal of Medicine and Science in Sports reviewed 104 separate studies and found that pre-exercise static stretching reduced muscle strength by an average of 5.8%, power output by 2.8%, and explosive performance by 2.9%. You are deliberately weakening the muscles you're about to ask to perform, and doing so in the name of safety. The mechanism is well understood. Static stretching reduces musculotendinous stiffness, the elastic energy storage capacity of muscle tendon units, which is precisely the stiffness that generates force during explosive and power-based movement. You are removing the spring before the jump. The injury prevention rationale, which is the entire justification for pre-workout stretching, has also been systematically reviewed and not confirmed. A 2004 Cochrane review and multiple subsequent reviews found insufficient evidence that stretching before exercise reduces injury rates in any meaningful way. What does reduce injury rates is a dynamic warm-up, leg swings, arm circles, sport-specific movement patterns, which elevates core temperature, activates the neuromuscular system, and improves joint lubrication without touching contractile force capacity. Static stretching does have a legitimate evidence-supported role in a fitness routine. Placed at the end of a session after muscles are warm, it improves range of motion over time and may reduce delayed onset muscle soreness. This mistake persists partly because physical education programs adopted static pre-workout stretching as doctrine in the 1970s and 80s, decades before the research base that would comprehensively contradict it. You have been letting the air out of your tires before the race and calling it preparation. 12. You take your vitamins first thing in the morning, before food, because you are disciplined and you believe that taking them early maximizes absorption. For fat-soluble vitamins, taking them without food renders them largely useless. For several other common supplements, taking them on an empty stomach causes direct gastric damage. Vitamins A, D, E, and K are fat-soluble. They are absorbed in the small intestine through the same biological mechanisms as dietary fat, requiring bile acids and fat-containing micelles to be transported across the gut wall. Without food-stimulated bile secretion, absorption rates can drop by over 50% according to clinical pharmacology data. You are spending money on supplements that are passing through you because you took them before your digestive system had the context it needed to absorb them. Iron supplements on an empty stomach are chemically effective but cause nausea, gastric mucosal irritation, and constipation at significantly higher rates than when taken with food. Clinical guidelines accept a modest absorption trade-off to reduce the GI consequences. High-dose niacin taken without food causes flushing, nausea, and in some cases hypotension, effects that are substantially reduced by co-ingestion with a meal. Zinc supplements on an empty stomach cause nausea in a significant proportion of users due to direct gastric irritation. This is a listed side effect in standard pharmacological references, not an edge case. Fish oil capsules taken without food produce the fishy burp reflux effect and GI discomfort that many users assume is simply a feature of the supplement. The maximum absorption first thing in the morning framework is a marketing concept applied to a pharmacological question with a very different answer. Timing and food co-ingestion requirements are entirely nutrient specific, and the blanket morning empty stomach approach serves almost none of them well. Your toilet has probably absorbed more of your supplement investment than you have. 13. The alarm goes off and you are not functional until coffee arrives. So coffee arrives immediately, before anything else, before food, before the day is properly started. You are flooding caffeine into a system where cortisol is already spiking sharply on its own, blunting the drug's effect, building tolerance faster, and interfering with your body's built-in morning alertness mechanism. Cortisol follows a circadian rhythm with a pronounced natural peak in the first 30 to 45 minutes after waking, called the cortisol awakening response. This is your body's endogenous alerting system. It exists and functions independently of any caffeine input. Caffeine works by blocking adenosine receptors, but adenosine hasn't accumulated enough in the first hour of waking to create significant drowsiness anyway. You are introducing an external stimulant to solve a problem that doesn't yet exist during a window when your own hormones are already handling the job. The consequence of this timing is that your body learns to rely on the external caffeine stimulus rather than its own cortisol peak, accelerating tolerance development and locking in a dependency that grows over time. Neuroscientist Andrew Huberman and chronobiology researchers broadly recommend delaying coffee by 90 to 120 minutes after waking, letting cortisol peak naturally and begin to fall before using caffeine to extend alertness rather than duplicate it. Consuming caffeine on an empty stomach immediately after waking also sharply increases gastric acid production without food present to buffer it, contributing to the acid reflux and gastritis that habitual or early morning coffee drinkers report at higher rates. The afternoon energy crash that sends many people back to the coffee machine is partly a consequence of front-loading caffeine too early, creating a stimulation curve that leaves the early afternoon unprotected. You have been turbocharging an engine that was already warming up and then blaming the afternoon for what your morning caused. 14. You wear fitted clothing because you look better in it, feel more put together, and the situation calls for it. What the situation is also producing is a compressive load on nerve pathways, digestive organs, and breathing mechanics that accumulates into documented medical conditions. Tight pants syndrome, meralgia paresthetica, is a formally recognized medical condition involving compression of the lateral femoral cutaneous nerve by tight waistbands. Symptoms include burning, numbness, and tingling along the outer thigh. And it is reported with increasing frequency in gastroenterology and neurology clinics as clothing has trended tighter across multiple demographics. A 2012 survey by a UK gastroenterology group found that wearing trousers 1 inch too small at the waist increased intra-abdominal pressure sufficiently to worsen gastroesophageal reflux and hiatal hernia symptoms measurably. The diaphragm, your primary breathing muscle, descends on inhalation and is mechanically restricted by tight waistbands and high compression garments, reducing tidal volume and forcing shallower upper chest breathing throughout the day. Physicians have specifically linked Spanx-style shapewear and compression garments to increase reports of acid reflux, bladder urgency, and altered bowel habit, all downstream consequences of sustained intra-abdominal compression. Chronically elevated intra-abdominal pressure is a recognized risk factor for pelvic floor dysfunction in women, contributing to stress urinary incontinence over time. Reduced circulation in the femoral triangle from sustained waistband pressure has been associated with increased risk of deep vein thrombosis in sedentary individuals, particularly relevant for long-haul flights in tight clothing. The architecture you chose for appearance is applying a compressive force to your digestive tract, your breathing, and at least 2 nerve pathways simultaneously. They have been paying rent on the consequences of your wardrobe choices, and none of them asked for the lease. 15. Breathing is automatic, so you've never thought about how you do it. And that absence of attention has allowed you to develop a dysfunctional breathing pattern that is elevating your baseline stress hormones, impairing oxygen delivery, and contributing to sleep disruption, anxiety, and cardiovascular strain you've attributed to everything except the most fundamental physical function you perform 23,000 times per day. Nasal breathing filters humidifies and warms incoming air and critically triggers the release of nitric oxide in the nasal sinuses, a vasodilator that increases oxygen absorption in the lungs by approximately 18% compared to mouth breathing. Chronic mouth breathing bypasses nitric oxide production entirely, delivers unfiltered air to the lower respiratory tract, dries out oral mucosa, increasing decay and infection risk, and is associated in multiple studies with higher rates of upper respiratory infection. Upper chest breathing, the default pattern in chronically stressed and sedentary adults, activates accessory respiratory muscles, including the scalens and upper trapezius rather than the diaphragm, and is physiologically associated with the sympathetic nervous system. Habitual upper chest breathers show elevated baseline cortisol and heart rate variability metrics consistent with chronic stress, measured and confirmed in clinical settings. Breathing at a slower rate, 8 to 12 breaths per minute using diaphragmatic mechanics, activates the parasympathetic nervous system and is used clinically in the treatment of hypertension, anxiety disorders, PTSD, and heart failure. Researcher Patrick McKeown linked habitual mouth breathing in children to measurable facial structural changes, dental malocclusion, and increased ADHD-like behaviors, demonstrating that breathing pattern produces structural consequences. CO2 tolerance, not just oxygen intake, regulates the Bohr effect, the mechanism by which oxygen is released from hemoglobin to tissues. Overbreathing reduces CO2 and paradoxically impairs oxygen delivery. You have been running a foundational biological function on its default settings your entire life, and the settings it defaulted to are costing you sleep, energy, and a functional nervous system. 16. You eat lunch at your desk because you're efficient, you have deliverables, and sitting in a break room for 20 minutes feels like a luxury the day can't absorb. Your digestive system disagrees with your schedule, and it's been disagreeing for years with measurable consequences. Digestion is primarily governed by the parasympathetic nervous system, the rest and digest system. Desk work maintains sympathetic nervous system dominance, the stress response state, which actively competes with and impairs digestive efficiency. Blood is shunted away from the gastrointestinal tract toward muscles and the brain during cognitive load, meaning your gut is receiving reduced circulatory resources precisely when you're asking it to process a meal. A 2013 study published in the American Journal of Clinical Nutrition found that eating while distracted by a computer task led to consuming approximately 10% more food at that meal and significantly more food later in the day, because the brain failed to fully encode the eating experience. Meal memory, the brain's formation of a record that eating occurred, is critical to satiety signaling. Directed attention is required for that encoding to happen properly. When you eat while working, the brain is partially occupied and the meal is only partially registered, impairing the hunger hormone calibration for the rest of the day. Scandinavian workplace health research consistently shows that employees who take genuine lunch breaks away from their workstations report lower afternoon cortisol, higher afternoon cognitive performance, and lower burnout scores than those who eat at their desks. The digestive system also benefits from upright, relaxed, non-compressed positioning. Hunching over a keyboard while eating increases intragastric pressure and the likelihood of acid reflux. You called a 20-minute recovery window a second shift, and your gut and your brain both noticed that you gave neither of them the transition they needed. 17. You brush your teeth, then you rinse with mouthwash, because that's the complete system. The chemical insurance policy that leaves your mouth clinically clean and minty and finished. You have just washed off the fluoride from your toothpaste before it had time to be absorbed into your enamel, which is the only reason the toothpaste was worth using in the first place. Fluoride works by being retained on and around enamel surfaces after brushing. Saliva gradually absorbs it over 30 to 60 minutes post-brush in a process called fluoride reservoir formation. Rinsing immediately removes this fluoride before absorption occurs, negating the primary protective chemistry of the brushing event you just completed. The NHS dental guidelines explicitly state this. Do not rinse with water or mouthwash immediately after brushing. Spit, but do not rinse. This is not a fringe recommendation. It is a mainstream clinical instruction that has been embedded in UK dental guidance for years and is increasingly adopted by dental associations elsewhere. A clinical study published in the Journal of Dentistry demonstrated measurably lower fluoride retention in tooth enamel in subjects who rinsed immediately post-brushing compared to those who did not rinse. The mouthwash itself introduces additional concerns. Alcohol-based mouthwash, the majority of what is sold commercially, desiccates oral mucosa, reduces salivary flow, and has been flagged by the WHO as an area of concern for heavy daily users. A 2019 study found that twice-daily antiseptic mouthwash use was associated with significantly increased blood pressure, attributed to the elimination of oral nitrate-reducing bacteria that produce nitric oxide, a compound critical to vascular function. The correct time to use mouthwash, if you use it at all, is before brushing or at a separate time entirely. You have been washing off your own toothpaste in the name of extra cleanliness, which is the most self-defeating possible way to end a dental hygiene routine. 18. You sit with one leg crossed over the other the moment you settle into a chair. It's your natural position, your default, and it has been for as long as you can remember. It feels neutral, it is not. Habitual leg crossing causes measurable pelvic tilt and spinal rotation, compresses the perineal nerve with documented neurological consequences, and produces a blood pressure increase that accumulates with every repetition across every day of your adult life. A 2010 study in blood pressure monitoring confirmed that crossing the legs at the knee produces an immediate reproducible increase in systolic blood pressure of approximately 7 millimeters of mercury. That number is clinically significant when it happens dozens of times daily for years. The perineal nerve wraps around the outside of the knee and is directly compressed by the weight of the crossed leg. Sustained compression causes foot drop, a temporary but occasionally persistent inability to lift the front of the foot, seen most commonly in people who habitually cross at the knee for long periods. Pelvic tilt from habitual unilateral leg crossing, and almost everyone crosses the same leg on top, creates asymmetric loading of the lumbar spine and sacroiliac joint, a documented contributor to chronic lower back pain and SI joint dysfunction. The tensor fascia latae and iliotibial band on the upper crossing side become chronically shortened, while the gluteus medius on the opposite side becomes reciprocally weakened. A muscular imbalance pattern that physical therapists identify consistently across patient populations. Venous return from the lower limbs is also impaired by sustained knee crossing, increasing superficial venous pooling and potentially contributing to varicose vein development over time. Your most comfortable sitting position has been quietly compressing a nerve, tilting your pelvis, and raising your blood pressure multiple times a day, and it looked effortlessly composed the entire time. 19. You finish your workout and you leave. You're done. You have somewhere to be, and the session is complete. What you have actually done is ended an intense cardiovascular event without giving your body a controlled exit, and that abrupt stop creates a measurable window of physiological vulnerability that you walk through every single time. During intense exercise, Your heart dramatically increases output to send blood to working muscles, and peripheral vasodilation occurs in those muscles to accommodate the demand. When you stop abruptly, peripheral vasodilation persists for several minutes while cardiac output drops sharply. Blood pools in the periphery, venous return to the heart falls, and cardiac preload decreases suddenly. This reduction causes exercise-induced hypotension, dizziness, lightheadedness, and in susceptible individuals, vasovagal syncope, which is the clinical term for fainting. This is why people occasionally collapse after stopping intense cardio suddenly, and it is not a fringe event. The first few minutes post-exercise represent the highest statistical window for exercise-induced cardiac events, including ventricular arrhythmias in people with undetected cardiac conditions. A gradual cool-down maintains cardiac preload and allows heart rate to descend safely along a controlled curve rather than a cliff. Lactic acid, the metabolite responsible for the burning sensation in working muscles, is cleared significantly faster through active recovery and light movement than through complete rest, meaning a cool down also reduces the onset and duration of delayed onset muscle soreness. Cortisol spikes acutely during intense exercise and begins declining during the recovery period. Abrupt cessation without a taper prolongs the cortisol elevation window. A 5 to 10 minute low intensity movement cool down is sufficient. The duration requirement is low. The risk of skipping it is not. You spent an hour deliberately loading your cardiovascular system and quit without warning, which is roughly the equivalent of landing a plane by cutting the engine and assuming physics will cooperate. 20. Your near vision started going and you solved it at the drugstore rack for $15. You picked a magnification that felt right, both eyes got the same lens, and you declared the problem handled. What you actually did was apply an uncorrected, asymmetric, astigmatism, ignoring optical intervention to a visual system that almost certainly does not match the assumptions built into that product. The vast majority of people have different refractive errors in each eye, a condition called anisometropia, and over-the-counter readers assume both eyes are identical and need precisely the same correction. Statistically, that assumption is wrong for most users. Pupillary distance, the measurement between your pupils, is also non-standardized in drugstore glasses. If the optical centers don't align with your actual pupils, the prism effect causes your eyes to work asymmetrically, generating significant eye muscle strain with every hour of use. Chronic muscle strain from misaligned optics produces frontal and temporal headaches, neck tension from unconscious head repositioning to find a comfortable focal plane, and contributes to digital eye strain in anyone using screens. Over-the-counter glasses also do not correct astigmatism, a cylindrical focusing error present in the majority of adults, meaning users with astigmatism are running an incomplete correction that leaves residual blur their ciliary muscles are continuously trying to compensate for. A study on over-the-counter reading glasses by the Journal of the American Optometric Association confirmed that while they provide adequate correction for some users, a significant proportion experience measurable increases in visual discomfort compared to properly prescribed lenses. Regular optometric evaluation also detects glaucoma, which is asymptomatic until vision is irretrievably lost, macular degeneration, and diabetic retinopathy. You self-diagnosed your vision, self-prescribed your correction, and skipped the professional whose entire job is catching the conditions that cause permanent blindness. The $15 felt responsible at the time. 21. You hold your urine because you're in a meeting, you're on a long drive, you're occupied with something that feels more important than your bladder's opinion on the matter. You have the discipline to override a biological signal, and you use it regularly. Chronically overriding the urinary urge desensitizes the bladder's mechanoreceptors, progressively reduces functional bladder capacity, increases the risk of urinary tract infections, and in extreme cases causes bladder rupture and urosepsis. A septic infection originating in the urinary system that carries a mortality rate of 12 to 22% when diagnosis is delayed. The bladder wall contains stretch-sensitive mechanoreceptors that signal the urge to void, Repeatedly suppressing this signal trains the brain-bladder axis to override normal filling thresholds. The result is either urgency incontinence, where the bladder begins contracting without adequate warning, or hyposensitivity, where sensation is so reduced that dangerous overfilling occurs without adequate urge. Prolonged urine retention creates an environment of static fluid, elevated temperature, and concentrated waste. Conditions that promote bacterial proliferation actively. This is the primary mechanism linking habitual retention to recurrent urinary tract infections, particularly in women. The pressure generated by a severely overdistended bladder can damage the detrusor muscle, the smooth muscle of the bladder wall, reducing its elasticity and contractile strength permanently, a condition called detrusor underactivity. Intra-abdominal pressure from a severely full bladder also affects the pelvic floor and contributes to pelvic organ prolapse risk in women with existing pelvic floor weakness. Normal voiding frequency for a healthy adult is approximately 6 to 8 times per day. Consistently going fewer than 5 times suggests chronic retention. Your bladder has been sending you a signal you've been treating like an inconvenient notification you can indefinitely swipe away, and it has been quietly remodeling itself around your stubbornness. 22. You finish a shower, grab a cotton swab, and clean your ears. It is satisfying. It appears to be something that requires doing, and the product has been in your bathroom your entire life. The instructions printed on every single box of cotton swabs explicitly state not to insert them into the ear canal, every box. The ear canal is lined with specialized epithelium that migrates laterally. Earwax, called ceramin, is naturally transported outward by this migratory skin movement toward the external ear. Swabbing reverses this process entirely, pushing wax deeper toward the eardrum rather than removing it. The most common cause of ceramin impaction, compacted wax that requires a physician to remove, is routine cotton swab use. Ear, nose, and throat specialists report impaction as one of the most frequent cotton swab-related presentations they see. The eardrum is located approximately 2.5 centimeters into the ear canal. Standard cotton swabs are long enough to reach it. Tympanic membrane perforation from cotton swab insertion is documented in medical literature with thousands of annual cases in the United States alone. Ceramin itself has documented antimicrobial properties, lubricates, and protects the canal's skin and helps trap debris. Removing it creates a drier, less protected canal environment more susceptible to otitis externa, commonly known as swimmer's ear. Cotton fibers shed from swabs can remain in the canal, accumulating over time and creating a foreign body irritant. Safe alternatives for ear hygiene include periodic irrigation with saline drops or commercially available ear cleaning kits reserved for instances of actual excessive buildup rather than as a daily ritual. You have been actively undermining your ear's self-cleaning system using a device whose own packaging told you not to do exactly what you were doing, which makes this one of the most thoroughly labeled mistakes on this entire list. 23. You skip a meal to create a caloric deficit because the logic is straightforward. Eat less, lose weight. Skipping a meal is just a faster route to the same destination. What it actually triggers is a specific hormonal and metabolic response designed to protect your body's energy reserves, and it does this job considerably better than your weight loss plan. Ghrelin, the primary hunger hormone, spikes sharply when meal timing is disrupted unpredictably. Unlike structured intermittent fasting, which the body adapts to over time, random meal skipping creates ghrelin spikes that drive compensatory overconsumption at the next eating opportunity, typically producing a net caloric surplus rather than a deficit. A 2015 study in the Journal of Nutritional Biochemistry found that skipping breakfast in non-adapted subjects resulted in increased visceral fat accumulation over a 12-week period, even when total daily calories were matched. Meal timing affected fat distribution independently of how much was consumed. The thermic effect of food, the metabolic energy cost of digesting a meal, represents a meaningful portion of daily caloric expenditure. Eliminating a meal eliminates one thermic event and reduces your total daily energy output. Cortisol is elevated during caloric restriction and meal skipping, driving preferential fat storage in the visceral abdominal compartment and breaking down lean muscle tissue for energy. Meaning what you lose is disproportionately muscle, not fat. Blood glucose instability from meal skipping impairs cognitive function, decision-making capacity, and willpower, making the choice to maintain dietary discipline at the next meal neurologically harder, precisely when you need it to be easiest. Structured intermittent fasting protocols produce benefit by adapting the hormonal response over time. Random meal skipping incurs the metabolic disruption without the adaptation. Your metabolism is a paranoid accountant, and it protected every fat cell it had while you congratulated yourself on the discipline. 24. You switched from regular soda to diet. 0 calories is on the label, and 0 calories means zero problem. This was the informed, responsible consumer choice, and multiple large-scale studies associate it with the same outcomes the switch was meant to prevent. The San Antonio Heart Study, tracking over 5,000 adults over 7 to 8 years, found that diet soft drink consumption was associated with significantly greater body mass index gain than regular soda consumption, controlling for other variables. The dose-response relationship strengthened with quantity consumed. The proposed mechanisms include a conditioned insulin response. The intense sweet taste triggers a cephalic phase insulin release even without glucose arriving, priming the body for caloric intake that doesn't appear and creating metabolic confusion over time. Gut microbiome disruption is another mechanism. Aspartame, sucralose, and saccharin have all been shown in animal and some human studies to alter gut bacterial composition toward profiles associated with glucose intolerance. Extreme sweetness intensity also recalibrates reward pathways, making unsweetened whole foods less palatable and driving increased consumption of sweet foods elsewhere in the diet. A 2017 study in stroke found that daily diet soda consumption was associated with 3 times the risk of stroke and dementia compared to no consumption, an association that remained after controlling for confounders. The phosphoric acid in diet sodas is identical to that in regular sodas. It demineralizes tooth enamel directly and in heavy long-term drinkers contributes to reduced bone mineral density. The International Agency for Research on Cancer classified aspartame as a Group 2B possible carcinogen in 2023. The 0-calorie label also creates a documented psychological licensing effect. People consume measurably more calories from other sources in the same sitting after a diet drink. The can was honest about the calories and said nothing else. 25. You can exercise during the week, but you make it count on weekends. Long sessions, serious effort, full athletic redemption for 5 days of sitting. You're active technically. What you are, clinically, is a person who is applying sudden high-intensity physical stress to a body that has been sedentary for 5 consecutive days, and that combination is associated with acute cardiac risk, high injury rates, and significantly inferior metabolic adaptation compared to the same total activity distributed across the week. Sudden, vigorous exercise in a deconditioned state activates the sympathetic nervous system sharply and elevates blood pressure dramatically. In individuals with undetected cardiovascular disease, this pattern is statistically associated with triggering acute myocardial infarction. The risk of cardiac arrest during exercise is highest in the least fit individuals performing sudden intense activity, which is a precise description of the weekend warrior between Monday and Friday. The musculoskeletal system adapts to exercise through progressive mechanical loading, loading tendons, ligaments, and joint cartilage heavily after 5 days of inactivity, exceeds the adaptive threshold and causes microtrauma without the cumulative recovery benefit of consistent training. This is the direct explanation for the high injury rates in weekend-only exercisers. Glucose metabolism and insulin sensitivity improve with each bout of exercise, but begin reverting within 24 to 48 hours in sedentary individuals. 5 consecutive inactive days means the metabolic benefits of the weekend session have largely dissipated before the next one begins. A 2017 study in JAMA Internal Medicine found that while weekend warriors showed some mortality benefit over the completely sedentary, their all-cause and cardiovascular mortality remains significantly higher than individuals meeting equivalent weekly activity totals through distributed exercise. Your cardiovascular system is not impressed by bulk deposits, and the physiology of adaptation does not recognize weekends as a concept. 26 flip-flops are comfortable, effortless, and socially acceptable for what feels like the majority of warm weather activities. You wear them to the grocery store, on errands, on long walks, and every step in them is altering your gait mechanics in ways that accumulate into the heel pain, knee misalignment, and tendon damage that your podiatrist will one day trace directly back to your footwear. A 2008 Auburn University biomechanical study found that flip-flop wearers take significantly shorter strides, demonstrate reduced ankle motion, and show altered heel strike patterns. The cumulative effect of this abnormal gait across thousands of daily steps creates chronic strain on the plantar fascia, Achilles, and patellar tendons. The toe gripping mechanism required to keep flip-flops from falling off activates the flexor digitorum, longus, and intrinsic foot muscles in an abnormal sustained contraction. Chronically overusing these structures causes metatarsalgia, pain at the ball of the foot, and contributes to hammer toe development over time. Plantar fasciitis, one of the most common musculoskeletal complaints in podiatric medicine, is directly associated with unsupportive footwear, and flip-flops are frequently cited in clinical presentations as a precipitating factor. The flat, zero-drop sole provides no shock absorption, transmitting ground reaction forces directly to the calcaneus, the heel bone, with each step, which is the direct mechanism behind the heel pain that flip-flop users disproportionately develop. The open toe design also dramatically increases exposure to foot injuries from dropped objects, stubbed toes, and surface contamination. Extended use over years has been documented to cause progressive flat foot in previously arched individuals as the foot musculature adapts to the absence of any support by allowing arch collapse. You selected the footwear option offering the least possible structural support and wore it everywhere on hard surfaces, and you are now mildly confused about why your heels are a problem every single morning. 27. It is there, it is visible, and your brain will not allow you to ignore it. You pop the pimple and feel the immediate resolution of tension that your nervous system has been building toward for the last 48 hours. What you have actually done is rupture a follicular wall deeper into the surrounding tissue, spread infection, dramatically increase the likelihood of a permanent scar, and in a specific zone of your face, introduced a non-zero risk of transmitting that infection directly toward your brain. Squeezing the surface of a pimple forces the contents, sebum, dead skin cells, and bacteria, into the surrounding dermis rather than outward, triggering a stronger inflammatory response and often producing a larger, deeper lesion than the original. Post-inflammatory hyperpigmentation, the dark marks that persist for months after a pimple, is caused by melanin overproduction driven by inflammation. Popping amplifies that inflammatory cascade, making hyperpigmentation more severe and persistent. The region of the face from the corners of the mouth to the nose bridge, called the danger triangle, is drained by venous pathways that connect to the cavernous sinus of the skull without venous valves. Bacterial introduction from follicle rupture in this zone can cause cavernous sinus thrombosis, a life-threatening intracranial infection. This outcome is documented in medical case reports. Open skin post-popping also introduces secondary bacterial species from fingertip flora, including Staphylococcus aureus and MRSA, into an already compromised follicle, a documented mechanism for secondary bacterial infections and abscess formation. Scarring from repeated follicular trauma is permanent. Dermal collagen disrupted by manual extraction heals in atrophic or hypertrophic patterns that cannot be corrected without medical procedures. You have been performing amateur surgery on your own face without gloves, anesthesia, or any knowledge of where the veins go. 28. You apply sunscreen on beach days and clear summer afternoons and skip it when the sky is overcast because you're responding to glare and warmth and the visible signs of solar intensity. What you are not responding to because you cannot see, feel, or detect it in any way is the ultraviolet radiation that is passing through that cloud cover at approximately 80% of its full unobstructed intensity. UVA radiation, the longer wavelength ultraviolet that penetrates cloud cover and glass, does not cause the visible acute burn that UVB produces. It causes no immediate sensation. It reaches deeper into the skin, damages DNA and basal layer cells, drives photoaging, and is the primary driver of melanoma risk. And it does all of this silently, asymptomatically, on every overcast day you've ever spent outdoors without protection. Melanoma is the most lethal form of skin cancer, and its incidence increased by more than 300% between 1975 and the present, a trend attributed largely to sun exposure behavior across decades. The Skin Cancer Foundation reports that approximately 23% of an individual's lifetime UV exposure occurs before age 18, meaning the cloudless and cloudy days of childhood are already contributing to adult cancer risk retrospectively. Windows in cars and offices block UVB, but allow UVA to pass through largely unimpeded. People seated near windows at work accumulate significant UVA exposure without any visible sign, which is why dermatologists observe asymmetric photoaging on the side of the face closest to the window. A single blistering sunburn in childhood doubles lifetime melanoma risk. Consistent daily broad-spectrum sunscreen use reduces overall melanoma incidence by approximately 50% in longitudinal Australian studies. SPF without broad-spectrum labeling does not cover UVA. The clouds are not a medical assessment tool for radiation exposure, and the radiation has never consulted the forecast. 29. Something hurts, and you take ibuprofen immediately because discomfort is a problem with a solution in your medicine cabinet and you are a person who solves problems efficiently. Routine use of NSAIDs, ibuprofen and naproxen, damages the gastrointestinal lining, impairs kidney function, and blunts the very inflammatory response your body needs to adapt from exercise. Acetaminophen, the alternative you may reach for instead, is the leading cause of acute liver failure in the United States. NSAIDs inhibit the COX-1 enzyme, which produces prostaglandins that protect the gastric mucosal lining. Remove that protection, and you remove the barrier between stomach acid and the stomach wall, causing gastric erosions, ulcers, and upper gastrointestinal bleeding. Approximately 16,500 deaths per year in the United States are attributed to NSAID-related gastrointestinal bleeding according to published gastroenterology estimates. A 2021 study in the Proceedings of the National Academy of Sciences found that resolving acute pain with anti-inflammatory drugs in animal models was associated with significantly higher rates of transition to chronic pain, suggesting that blocking the inflammatory resolution process may interfere with the immune pathways that normally terminate pain signaling. Post-exercise NSAID use specifically blunts the prostaglandin-mediated inflammatory cascade that stimulates muscle protein synthesis and satellite cell activation, meaning ibuprofen after a workout partially inhibits the adaptive response the workout was designed to produce. Acetaminophen's therapeutic window is narrow. The maximum safe daily dose for healthy adults is only approximately double the standard dose, and many people inadvertently exceed it by stacking it across multiple products, cold medicines, sleep aids, and prescription combinations, without recognizing the overlap. Acetaminophen toxicity accounts for approximately 50% of acute liver failure cases in the United States. Pain is physiological information. You have been silencing the diagnostic signal before investigating its source, and the kitchen has not been fine this whole time. 30. When exercise gets hard, you open your mouth wide and push air through as fast as possible because more airflow must mean more oxygen, and more oxygen must mean better performance. The logic is intuitive. The biology runs the opposite direction. Mouth breathing during exercise reduces performance by impairing CO2 tolerance eliminating the nitric oxide production your lungs depend on, and shifting the work of breathing from your diaphragm to accessory muscles that fatigue faster and generate less efficiency per effort. The Bohr effect dictates that oxygen release from hemoglobin to working muscles is governed by CO2 concentration. CO2 is the chemical trigger that causes hemoglobin to release its oxygen payload to tissues. Mouth breathing hyperventilates, blowing off CO2, and paradoxically reduces oxygen delivery to your muscles even as it increases the volume of air moving through your lungs. You are breathing more and oxygenating less. Nasal breathing produces nitric oxide in the sinuses, a vasodilator that increases bronchodilation and pulmonary blood flow, optimizing the efficiency of the entire oxygen exchange system. This effect is completely absent with mouth breathing. Research documented by Patrick McKeown and others shows that athletes trained in nasal-only breathing at low to moderate intensity develop improved CO2 tolerance, allowing them to perform equivalent work at lower respiratory rates, a direct efficiency gain. The diaphragm is the primary respiratory muscle, and mouth breathing during exercise tends to shift ventilation toward upper chest accessory muscles, the scalens and intercostals, which fatigue faster and deliver less breathing efficiency per unit of effort. Nasal resistance is approximately twice that of oral resistance, and that resistance is not a design flaw. It trains the diaphragm and slows breathing rate, improving tidal volume utilization rather than just increasing rate. Nasal adaptation during exercise requires 2 to 4 weeks of deliberate low-intensity practice, which is why most people abandon it before experiencing what it produces. 31. You chew gum through your commute, your work sessions, your afternoon slump, because it keeps your breath manageable, occupies your jaw, and maybe burns a calorie. It is overloading one of the strongest joints in your body, acidifying your stomach, asymmetrically remodeling your face, and, easy for most sugar-free varieties, dosing you with a compound that has a dose-dependent laxative effect. The masseter muscle is one of the strongest muscles in the body relative to its size. Chronically overworking it through all-day gum chewing causes masseter hypertrophy, visible jaw widening, and TMJ capsule inflammation, which is how temporomandibular disorder develops, jaw pain, clicking, locking, and referred ear pain that many sufferers spend years attributing to other causes. Most people chew on a preferred side, creating asymmetric muscle development and uneven occlusal loading, which distributes force unevenly across tooth surfaces and accelerates enamel wear on the dominant chewing side. Chewing stimulates the cephalic phase of digestion, saliva production, gastric acid secretion, and digestive enzyme release, all in preparation for food that never arrives. This produces excess gastric acid in an empty stomach, directly contributing to acid reflux and gastric mucosal irritation in habitual gum chewers. Sugar-free gum uses sugar alcohols, primarily sorbitol, as sweeteners. Sorbitol is osmotically active in the gut. It draws water into the intestinal lumen and has a dose-dependent laxative effect. Consuming more than 20 grams of sorbitol daily, achievable with heavy gum chewing, causes osmotic diarrhea. Headaches originating at the temples in habitual gum chewers are frequently missed TMJ and masseter origin headaches misattributed to stress or tension. Your harmless focus habit has been grinding your jaw joint, acidifying your stomach, and gradually restructuring your face, while contributing nothing measurable to your concentration. 32. You've always slept on your stomach. It's your position, it's comfortable, and you wake up functional most mornings, so you have filed this under non-issues. What you have been doing is forcing your cervical spine into sustained lateral rotation for 6 to 8 hours per night, compressing lumbar vertebrae, restricting diaphragmatic movement, and applying sustained pressure to the brachial plexus, all while your body is supposed to be recovering. The cervical spine is designed for neutral alignment or slight flexion during sleep. Turning your head 70 to 90 degrees laterally for an entire sleep cycle places the facet joints, intervertebral discs, and cervical musculature in a sustained biomechanically compromised position. A primary contributor to the chronic neck stiffness and cervicogenic headaches, that stomach sleepers disproportionately report and typically normalize as just how their mornings feel, the lumbar spine hyperextends against the mattress in the prone position, compressing the posterior spinal elements, facet joints, and spinous processes, which is particularly problematic for anyone with lumbar spinal stenosis or posterior disc pathology. The brachial plexus, the nerve network supplying the arm and hand, is compressed by the combined weight of the head and shoulder in the prone position, which is the direct cause of the dead arm and hand numbness that stomach sleepers frequently experience and have simply accepted as normal. Prone sleeping measurably restricts diaphragmatic excursion because the abdomen cannot expand freely into the mattress, shifting breathing mechanics toward the upper chest and mildly reducing overnight blood oxygenation. Stomach sleeping is also associated with accelerated facial wrinkle formation on the contact side. Sustained mechanical compression of collagen for 8 hours per night over years creates permanent sleep line wrinkles and asymmetric facial aging. You have spent roughly 1/3 of your life twisting your spine into a configuration your anatomy didn't design, and you have been blaming your neck every single morning for simply reporting the situation accurately. 33. You have hand sanitizer in your bag, your car, your desk drawer, and you use it constantly because it kills 99.9% of bacteria, and that number sounds like comprehensive protection. The 99.9% figure is derived from standardized in vitro testing on clean, hard surfaces under controlled laboratory conditions, not on human hands in real environments with organic matter, dried proteins, and oils. On contaminated hands, efficacy drops substantially. Norovirus, the most common cause of acute gastroenteritis, affecting roughly 21 million Americans annually, is a non-enveloped virus with demonstrated resistance to alcohol-based sanitizers. Soap and water is the appropriate intervention. Clostridium difficile produces endospores that are completely alcohol resistant, and the CDC specifically warns that hand sanitizer should not be used for C. Diff prevention, mechanical removal through soap and water scrubbing, is required to physically displace the spores. Repeated alcohol exposure strips the stratum corneum lipid matrix, increasing transepidermal water loss and creating microfissures in the skin surface, meaning chronically dry and cracked skin from over-sanitizing provides more pathogen entry points than intact moisturized skin would. You are creating the vulnerability you are trying to prevent. Alcohol sanitizers are appropriate and well evidenced for specific clinical and high-contact public health scenarios where soap and water are unavailable, and there is no argument against their use in those contexts. The problem is treating them as a universal equivalent to hand washing across all pathogen types, which the chemistry does not support. You selected the 99.9% effective option without reading the fine print listing the pathogens that constitute the other 0.1%, which are, somewhat inconveniently, the ones most likely to ruin your November. 34. You can't sleep, and melatonin is something your body already makes, so taking it is basically just supplementing a natural process with a natural compound. This reasoning is sound, and the execution is almost certainly wrong. Most commercial melatonin doses are 5 to 10 times higher than the concentration your body produces physiologically. The supplements are barely regulated for accuracy or content, and chronic use suppresses your own production. Building a reliance on an exogenous source of a hormone you are entirely capable of manufacturing. Human physiological nighttime melatonin levels peak at approximately 0.1 to 0.3 milligrams. Standard commercial tablets are sold in 3, 5, and 10 milligram doses, representing 10 to 100 times the physiological concentration. MIT sleep researcher Richard Wertman published research demonstrating that 0.3 milligrams is as effective as 3 milligrams for sleep onset while avoiding the receptor desensitization that higher doses produce. A 2023 analysis of 25 commercial melatonin supplements found that actual content ranged from 83% below to 478% above the labeled dose, meaning you may be taking dramatically more or less than you believe on any given night. The pineal gland's melatonin synthesis is subject to negative feedback. When exogenous melatonin is chronically present endogenous production is suppressed. Users who rely on supplements long term may find their natural production diminished without them. Melatonin is a circadian timing signal, not a sedative. It shifts the phase of the sleep-wake cycle, but does not induce sleep depth or architecture the way sleep medicine addresses underlying insomnia. Using it for general sleeplessness without addressing the circadian root cause is pharmacologically misdirected. You chose the natural option, took 10 times the required dose in an unverified concentration, and have been teaching your brain to outsource a function it was built to perform. 35. You wear your earphones at whatever volume it takes to hear them over the background noise of your commute, your gym, your open plan office, and you've done this for years, possibly a decade or more, and your hearing seems fine. What you cannot perceive is the damage accumulating in the one sensory system in your body that does not repair itself. The World Health Organization estimates that approximately 1.1 billion young people aged 12 to 35 are at risk of hearing loss due to recreational exposure from personal audio devices. Cochlear hair cells, the sensory receptors that convert sound waves into electrical signals, do not regenerate in humans once destroyed. This makes noise-induced hearing loss permanent, progressive, and currently irreversible by any available medical intervention. The damage begins at the 4,000 Hz frequency range, creating a gap in your audiogram called a 4 kHz notch that is completely invisible to you in daily life. You will not notice it until the loss spreads into the speech frequencies between 500 and 3,000 Hz, at which point conversation comprehension begins to deteriorate and the window for preservation has already closed. Typical noise-canceling or in-ear isolation earphones allow lower volumes to be effective. The danger is in open-style headphones used in noisy environments, where users increase volume to overcome background sound, frequently exceeding 100 decibels. The OSHA permissible exposure limit is 85 decibels over 8 hours. At 100 decibels, the damage threshold is 15 minutes. At 110 decibels, it is under 2 minutes. Tinnitus, chronic, permanent ringing in the ears, affects approximately 15% of the United States adult population and is the most common early marker of cochlear hair cell damage. Most sufferers report it began during their young adult years. You have been slowly and permanently dismantling a sensory system that cannot send you a warning until the damage is already done, and the only signal it can produce is a ringing that never stops. 36. Dinner on the couch with something playing is how your evening ends. It's relaxing, it's how most households operate, and it feels like a reasonable wind down after a demanding day. It is also one of the most consistently replicated causes of overeating in nutritional research, and it has been quietly expanding your caloric intake every night while you've watched something you can barely remember. A 2013 meta-analysis published in the American Journal of Clinical Nutrition reviewed 24 studies and found that distracted eating increased food intake during the meal by approximately 10% and increased caloric intake later in the day by approximately 25%. The mechanism is meal memory, the brain's encoding of the eating event. Directed attention is required for this encoding to happen properly, and when your attention is on a screen, the meal is only partially registered. Hunger-regulating hormones, ghrelin, GLP-1, and PYY, fail to produce normal satiety signaling when meal memory is impaired, and food intake at the next meal is disinhibited as a result. Screen viewing also produces eating behaviors that are faster with less chewing and larger portions, because visual occupation reduces the sensory engagement with food that normally moderates intake. A Harvard School of Public Health prospective study tracking over 50,000 women for 6 years found that each additional 2 hours of daily television watching was associated with a 23% increased risk of obesity and a 14% increased risk of type 2 diabetes. The association between screen-present meals and childhood obesity is one of the most replicated findings in pediatric nutrition research. Meal duration also decreases significantly in front of screens, reducing the time window for satiety hormones, which have a 15 to 20 minute lag from meal initiation, to register fullness before the plate is empty. You gave your satiety system's moment of need to the television, and it has been returning the favor in the form of a deficit that shows up on a scale. 37, the day was hard, a drink helps, and this is what adults do. It's culturally endorsed, socially normalized, and it works in the short term, which is precisely why the long-term consequence is so reliable and so underappreciated. Alcohol reduces anxiety in the short term by increasing GABA activity and inhibiting glutamate. Chemically effective, temporarily, and accompanied by a neuroadaptation that progressively worsens your baseline anxiety over time. The CNS responds to chronic GABAergic stimulation by downregulating GABA receptors and upregulating glutamate receptors to maintain homeostasis. Between drinking episodes, the baseline brain state shifts toward excitatory dominance, producing increased anxiety, irritability, and stress reactivity when sober. This is a well-documented feature of developing alcohol use disorder and is present even in heavy social drinkers who would not identify as having a problem. A large 2019 study in PLOS Medicine found a dose-dependent dosity relationship between long-term alcohol use and anxiety disorders. Even moderate drinking above 14 units per week was associated with significantly higher anxiety prevalence. Alcohol also dismantles sleep architecture regardless of how easily it causes you to fall asleep. It suppresses REM sleep and causes fragmentation in the second half of the night during the rebound activation phase, leaving chronic drinkers in accumulated REM debt that worsens cognitive function and emotional regulation, both of which are prerequisites for actually managing stress. Cortisol levels are acutely elevated during alcohol metabolism, not reduced. The HPA axis is progressively dysregulated with chronic exposure, increasing baseline cortisol and reducing resilience to subsequent stressors. The perceived relief is neurologically real and reinforced, which is exactly how the cycle becomes self-sustaining. Anxiety drives drinking, drinking produces neuroadaptation increases anxiety, and more is required to achieve the same relief. You found a mechanism for temporary stress reduction that makes you more stressed by design. 38. You wear heels because the situation calls for it. Professional environments, social occasions, the accumulated expectation that certain contexts require a particular kind of footwear. What those contexts are also requiring is that you shift 75% of your body weight onto the ball of your foot for the duration, compress a nerve between your third and fourth metatarsals, shorten your Achilles tendon, and progressively increase the compressive force across your knee joint with every inch of elevation. A 2010 study published in the Journal of Applied Physiology demonstrated that women who wore heels 5 or more days per week had measurably shorter gastrocnemius muscle fiber length and increased Achilles tendon stiffness compared to non-heel wearers, structural adaptations that cause pain and functional limitation when barefoot or in flat shoes. The tendon adapts to wherever you consistently place it. If you place it in an elevated position for the majority of your waking hours, it shortens to match and flat ground becomes uncomfortable. Shortened Achilles and calf structures alter the entire lower kinetic chain. Compensatory changes in knee flexion, pelvic tilt, and lumbar curvature are documented with regular heel use, contributing to knee osteoarthritis and chronic lumbar pain over time. A study published in Arthritis Care and Research found that a single 3-inch heel increases compressive force across the knee joint by approximately 23%, a mechanism cited in research on the higher rates of knee osteoarthritis in women compared to men. Morton's neuroma, a painful benign nerve tumor between the third and fourth metatarsals requiring surgical intervention in severe cases, develops from sustained forefoot overloading that heels specifically produce. Ankle sprains in heels involve higher grade ligament tears due to the extreme inversion moment arm the elevation creates. You have been paying structurally for a presentation choice, and the Achilles tendon adapts to wherever you consistently place it, not wherever you'd prefer it to end up. 39. You push through. You manage. You wait until something is genuinely, unmistakably wrong before you consider asking for help, because functional people handle their internal weather themselves, and seeking support before crisis feels like an overreaction. Mental health conditions are progressive neurobiological disorders, and delaying treatment allows structural brain changes to accumulate, reduces treatment responsiveness over time, and allows physical health consequences to develop that earlier intervention would have prevented. Untreated depression produces measurable reductions in hippocampal volume. The hippocampus is critical for memory, emotion regulation, and spatial reasoning. A 2011 meta-analysis confirmed that major depressive disorder is associated with progressive hippocampal atrophy, with severity proportional to illness duration and number of untreated episodes. The kindling hypothesis in mood disorders describes how each untreated episode lowers the threshold for the next. Subsequent episodes become easier to trigger with less severe stressors, and early intervention breaks the sensitization cycle before it becomes self-reinforcing. Depression is now formally recognized as a systemic inflammatory condition associated with chronically elevated CRP, IL-6, and TNF-alpha, inflammatory markers that independently predict cardiovascular disease, type 2 diabetes, and all-cause mortality. The immune and cardiovascular consequences are not metaphorical, they are measurable, and they accumulate during the years of waiting. Treatment-resistant depression, BIRPRAINS, which fails to respond to multiple medication trials, is significantly more common in individuals with longer histories of untreated illness. Waiting does not make the intervention cleaner or simpler, it systematically reduces its effectiveness. Psychotherapy, specifically cognitive behavioral therapy, produces measurable changes in neurological function visible on functional MRI. Reduced amygdala hyperreactivity, increased prefrontal engagement, and altered default mode network activity. These changes are achievable early in treatment and become harder to produce as illness duration extends. You have been waiting for the structural damage to become obvious before addressing its cause, and the repair has been getting more complicated the entire time you waited. 40, the alarm goes off, and before you've taken 3 full breaths, you're reading messages, scanning notifications, checking headlines. You're informed and connected and already reacting to other people's priorities, and your prefrontal cortex isn't fully operational yet. Sleep inertia, the transitional neurological state between sleep and full waking consciousness, lasts 15 to 60 minutes after waking. During this period, the prefrontal cortex, which handles rational thinking, impulse control, and executive function, is not yet running at full capacity, while subcortical structures, including the amygdala, are already active. Introducing socially threatening information, a difficult email, a news alert, a social media comparison, during sleep inertia, when the prefrontal brake on the amygdala is not yet engaged, amplifies emotional reactivity. Negative information is processed disproportionately without the usual cortical modulation, and the emotional tone this sets in the first waking minutes influences the entire day's stress trajectory. Cortisol peaks naturally in the first 30 to 45 minutes after waking, the cortisol awakening response, functioning as an endogenous alerting and cognitive priming mechanism. Filling this window with reactive information processing diverts the cognitive resources this peak was designed to support toward other people's agendas rather than your own. Research on decision-making quality shows that major cognitive tasks are best performed 90 to 120 minutes after waking, after full prefrontal engagement. Spending this window on reactive social media depletes the executive function resources needed for high-quality, deliberate thinking later in the day. The brain's threat detection system generates a cortisol and adrenaline response to threatening information regardless of whether the threat is physically present. A difficult email triggers the same acute physiological response as a genuine proximal stressor. Morning phone checking is also self-reinforcing through variable reward mechanisms in social media, and the disoriented low-resistance waking state is the moment of maximum vulnerability to that loop. You handed your most neurologically fragile daily window to whoever felt like emailing you last night. 41. You want to lose weight, so you run long, hard, frequent. Because cardio burns calories, more cardio burns more calories, and you are solving a straightforward arithmetic problem with your legs. Your body is not a simple arithmetic problem. It is a system with approximately 40,000 years of experience defending your body weight, and it is better at this than you are. High volume long distance running for weight loss specifically triggers compensatory mechanisms. Increased hunger, reduced incidental movement, and metabolic adaptation that reliably offset a substantial portion of the caloric expenditure. A concept called metabolic compensation describes the body's adaptive response to sustained exercise, induced caloric deficit, resting metabolic rate decreases, thyroid output adjusts downward, and NEAT, non-exercise activity thermogenesis, the calories burned through fidgeting and incidental movement, decreases involuntarily. A 2012 study in the Journal of Obesity found that exercise-induced caloric expenditure is partially offset by an approximately 30% reduction in NEAT, meaning if you burn 400 calories running, your body quietly eliminates roughly 120 calories of incidental movement elsewhere in the day without your awareness or consent. Prolonged aerobic exercise over 60 minutes significantly elevates ghrelin, driving greater caloric intake at subsequent meals than resistance training of equivalent caloric cost. Chronic high-volume running also elevates cortisol in ways that drive muscle catabolism and preferential visceral fat retention, meaning running can simultaneously reduce lean mass while protecting fat stores in hormonally stressed individuals. Post-exercise oxygen consumption following long steady-state cardio is minimal. Resistance training continues burning calories at an elevated rate for 24 to 48 hours after the session by comparison. Your physiology has been defending your body weight since before written history, and it has treated your fitness goals as an interesting but ultimately manageable inconvenience. 42. You work on a screen all day, decompress on a screen in the evening, and fall asleep next to one. And your eyes, your cervical spine, and the focal length of your vision are all being shaped by this environmental reality in ways that are structural, progressive, and not reversible by simply wanting them to stop. Myopia, nearsightedness, has doubled in prevalence since the 1970s in the United States and Europe. In East Asian countries where screen culture and sustained near-distance study time is most concentrated, it now affects 80 to 90% of young adults. The ophthalmological community attributes this to environmental shift rather than genetic change, with sustained near-distance visual work as the primary driver. The proposed mechanism involves the ciliary muscle contracting to maintain near focus, sending a signal to the eye to elongate its axial length. And axial elongation is the structural change that defines myopia. Childhood and adolescent eyes are particularly susceptible during growth years. Outdoor light exposure, specifically high-intensity natural light independent of physical activity, has been shown in multiple prospective trials to reduce myopia progression. Children who spend at least 2 hours per day outdoors have significantly lower myopia incidence, likely because bright outdoor light stimulates retinal dopamine release that counteracts axial elongation signals. Digital eye strain affects an estimated 50 to 90% of computer users. Blink rate decreases by approximately 60% during screen focus, significantly reducing tear film distribution and causing ocular surface desiccation that produces dryness, blurred vision, and headaches. The 20-20 rule, every 20 minutes, look at something 20 feet away for 20 seconds, is the standard clinical recommendation and interrupts the sustained accommodation cycle. Prolonged near-screen posture also places the head in a forward position that increases the effective weight on the cervical spine from approximately 12 pounds to 60 pounds at 60 degrees of tilt. You have been elongating your eyeballs and loading your cervical discs simultaneously, and the intervention requires looking out a window. 43. You don't think about grip strength because you're not a power lifter, and it seems like a metric for people with very specific goals that are not your goals. It is one of the single most powerful predictors of how long you will live, and it is something you have probably never once measured or trained deliberately. The Pure Study, Prospective Urban Rural Epidemiology. One of the largest cardiovascular studies ever conducted, spanning 17 countries and over 140,000 participants, found that each 5 kilogram decrease in grip strength was associated with a 17% increased risk of cardiovascular mortality, a 9% increased risk of stroke, and a 7% increased risk of myocardial infarction. A 2015 Lancet study found grip strength to be a better predictor of cardiovascular disease mortality than systolic blood pressure, which is notable because blood pressure monitoring is a global public health priority, while grip strength is almost never discussed outside of geriatric medicine. Grip strength correlates with total body lean muscle mass and is a proxy measure for systemic musculoskeletal reserve, the body's full capacity to perform physical tasks and recover from illness, injury, and surgery. Low muscle mass, called sarcopenia, is independently associated with poor outcomes across every major disease category. Sarcopenia begins measurably in your 30s and accelerates after 50. Grip strength decline is an early measurable indicator and a critical early warning sign. Low grip strength in hospitalized patients is a stronger predictor of post-surgical complications, length of stay, and 1-year mortality than most standard clinical measures routinely ordered on admission. The intervention is not complicated: dead hangs, farmer's carries, resistance training, and the response to training is measurable. The most statistically reliable single measurement of your longevity is something you've never tracked, and it improves with equipment available at every gym on Earth. 44. The water comes out of the tap, the government regulates it, and you drink it without thinking because thinking about it feels adjacent to wearing a foil hat. The EPA's legal limits for water contaminants are not the same as the concentrations at which no known health risk exists. For arsenic, the maximum contaminant level is 10 parts per billion, while the maximum contaminant level goal, the level at which no known health risk exists, is 0. The current removal threshold is set by what's economically practical, not by what's biologically safe. PFAS, per- and polyfluoroalkyl substances used in industrial processes and firefighting foam, contaminate the drinking water of an estimated 45% of United States tap water systems, according to a 2023 United States Geological Survey study. They are associated with thyroid disruption, immune suppression, and kidney and testicular cancer, and they do not break down in the environment or the human body, which is why they are called forever chemicals. Lead enters drinking water not from treatment plants, but from aging service lines and indoor plumbing fixtures. The events in Flint, Michigan were not an anomaly, but an exposed example of a widespread infrastructure condition affecting thousands of municipalities. Disinfection byproducts formed when chlorine reacts with organic matter in water, including trihalomethanes and haloacetic acids, are classified as probable carcinogens, and long-term exposure above regulatory thresholds is associated with bladder cancer and reproductive effects. Water quality reports are publicly available and legally required to be provided annually. Most people never read them. The Environmental Working Group maintains a searchable database of tap water quality by zip code. Simple point-of-use filtration through activated carbon or reverse osmosis removes the majority of common contaminants at a fraction of the cost of bottled water, which is subject to less rigorous testing requirements than tap water. Reading your water report is not a conspiracy, it is homework. 45. You avoid weights because you don't want to bulk up. You have a specific physique concern, and resistance training seems designed to work against it. You have been avoiding the single most effective tool available for long-term metabolic health, bone density, sarcopenia prevention, and survival, based on a misunderstanding of how muscle growth actually works. Significant muscle hypertrophy requires a precise convergence of genetic predisposition, structured progressive overload programming, a meaningful caloric surplus, and in many competitive cases, exogenous anabolic hormone use. The idea that recreational resistance training will cause a casual gym goer to accidentally develop an unwanted amount of muscle is not supported by exercise physiology. Most people who deliberately attempt to build significant muscle mass struggle considerably to do so even with dedicated programming and intentional effort. Muscle tissue is metabolically active. Each pound of lean muscle burns approximately 6 to 10 calories per day at rest. Building and maintaining lean mass is the most effective long-term resting metabolic rate intervention available. Sarcopenia, progressive muscle loss beginning in the 30s at 3 to 5% per decade and accelerating after 60, is a recognized medical diagnosis directly linked to frailty, fall risk, metabolic dysfunction, and excess mortality. Resistance training is the only proven intervention that reverses it. Bone mineral density is directly stimulated by mechanical loading. Weight bearing and resistance training provide the osteogenic stimulus required to maintain bone density across aging. Osteoporosis prevention cannot be achieved with cardiovascular exercise alone, and this is among the strongest evidence-based recommendations for women approaching perimenopause. WHO guidelines explicitly recommend resistance training on at least 2 days per week as a universal adult health recommendation. Women have approximately 10 to 15 times less testosterone than men and almost no biological capacity for the rapid hypertrophy they fear. Your skeleton is going to notice the absence of this intervention in approximately 20 years. 46. Your contact lenses still feel comfortable and still look clear, so you wear them a second day, a third, another week past the replacement date because they are expensive and waste feels irresponsible. The cornea receives its oxygen directly from the atmosphere rather than from blood vessels. It is the only tissue in your body that works this way. And contact lenses reduce this oxygen transmission. Lenses worn beyond their replacement schedule accumulate protein deposits and bacterial biofilm that further reduce gas permeability, progressively depriving corneal cells of the oxygen they require. Corneal hypoxia drives neovascularization, the growth of new blood vessels into the normally vessel-free cornea, which permanently compromises corneal clarity and can disqualify patients from future laser vision correction. Acanthamoeba keratitis is an infection caused by a common environmental amoeba found in tap water, pools, and soil that is almost exclusively a contact lens-related condition. The amoeba adheres to corneal surfaces compromised by overwear. It is notoriously resistant to standard antibiotics, frequently requires months of intensive treatment, and causes severe pain and permanent scarring in a significant proportion of cases. Bacterial keratitis, corneal ulcers from bacterial infection, most commonly Pseudomonas aeruginosa in contact lens users, can destroy full-thickness corneal tissue within 24 to 48 hours if not treated, requiring hospitalization and intravenous antibiotics in severe presentations. Sleeping in contact lenses increases corneal infection risk by 6 to 8 times. The closed eye environment creates anaerobic, low-oxygen conditions and prevents normal tear film exchange that clears pathogens from the ocular surface. The cost of extended contact lens wear is a documented factor in overwear behavior, and many manufacturers offer rebate programs and vision insurance plans that substantially reduce the financial barrier. You extended your lenses past their schedule and put your corneal oxygen supply and infection risk on a payment plan that your optometrist will one day collect on in very strong clinical language. 47. You eat fast because the food is good, because you're busy, because that is simply your pace, and it has been your entire life. This pace bypasses the 15 to 20 minute hormonal satiety delay built into human physiology, overstresses the digestive system, and is independently associated with metabolic syndrome, obesity, type 2 diabetes, and gastroesophageal reflux disease in research substantial enough that Japanese public health campaigns have specifically targeted eating speed as a modifiable national health risk. Leptin and GLP-1, two primary satiety hormones, require approximately 15 to 20 minutes from meal initiation to reach concentrations sufficient to signal fullness to the hypothalamus. Finishing a meal in under 10 minutes means you have completed eating before the hormonal signal has arrived. You have been chronologically ahead of your own satiety system for your entire adult life. A 2017 study published in the BMJ, drawing on data from 59,717 Japanese adults, found that fast eaters were 5.5 times more likely to develop metabolic syndrome compared to slow eaters, adjusting for total caloric intake, physical activity, and demographic variables. The eating speed effect was independent of what or how much was consumed. Inadequate chewing delivers poorly masticated food particles to the stomach and small intestine with reduced enzyme surface area exposure, leading to incomplete nutrient absorption and increased fermentation in the colon. The esophagus relies on coordinated peristaltic contractions to move food safely. Rapid eating outpaces this coordination, increasing pressure at the lower esophageal junction and contributing to GERD and hiatal hernia risk. Gastric stretch receptor activation contributes to satiety, but large, quickly swallowed boluses bypass the chewing-induced cephalic satiety signals that normally begin moderating intake before stomach volume is reached. A simple behavioral intervention, utensils down between bites, smaller utensils, non-dominant hand, has been shown in clinical trials to meaningfully slow eating speed. You finished every meal before your hormones could participate in the decision. 48. Your feet exist at the bottom of your priority list, in socks, unseen and unconsidered, doing their job without complaint while you moisturize everything above the ankle and call yourself attentive to your health. The foot is a 26 bone, 33 joint, 100 plus muscle tendon ligament structure, forming the foundational kinetic input for every movement you make. Neglecting it produces biomechanical cascades that show up as knee pain, hip pain, and back pain. Diagnosed and treated at the location of the symptom rather than at its origin in the foot. The subtalar joint controls pronation and supination and directly influences tibial rotation, which directly influences femoral rotation, which directly influences pelvic position. Excessive pronation at the foot is biomechanically transmitted up the entire lower kinetic chain and is a documented contributing factor to patellofemoral syndrome, iliotibial band syndrome, hip bursitis, and sacroiliac joint dysfunction. Plantar fasciitis affects approximately 2 million Americans annually, is among the slowest musculoskeletal conditions to resolve, frequently requiring 6 to 18 months, and is directly caused by inadequate foot intrinsic muscle strength and biomechanical loading on the plantar fascial band. The intrinsic foot muscles atrophy progressively from a lifetime of supportive footwear, reducing dynamic arch support, and proprioceptive accuracy, and directly increasing fall risk in older adults. Toenail neglect creates conditions for onychomycosis, fungal nail infection, affecting 10% of the general population and up to 50% of individuals over 70. The infection is difficult to treat, requiring months of antifungal therapy, and serves as a persistent reservoir for athletes' foot and skin infections. In diabetic individuals, foot neglect is the leading pathway to plantar ulcers and non-traumatic lower limb amputation. Simple interventions, daily moisturization, intrinsic foot exercises, appropriate footwear, provide significant downstream orthopedic benefit. You have been ignoring your only 2 contact points with the ground and then paying specialists to address the consequences at knee, hip, and back level. 49. You feel fine, and in your experience, if something were seriously wrong, you would have some indication of it, so you'll go to the doctor when there's a reason to go. The conditions with the highest mortality rates are either completely asymptomatic until advanced, or produce symptoms only after the window for effective intervention has closed substantially. Colorectal cancer is the second leading cause of cancer death in the United States. The 5-year survival rate for stage 1 colorectal cancer is approximately 90%. For stage 4, it is approximately 14%. The average patient presents at stage 3 or 4 because stage 1 and 2 are asymptomatic. Colonoscopy detects precancerous polyps before malignant transformation occurs, and the opportunity to use it is time limited. Hypertension affects nearly 50% of United States adults and is called the silent killer, not metaphorically, but literally. Blood vessels and organs are damaged progressively by elevated pressure with no pain, no obvious symptoms, and no advance notice before the stroke, heart attack, or kidney failure event. Blood pressure measurement takes 60 seconds and reveals this entirely. Type 2 diabetes is preceded by years of pre-diabetes during which vascular and nerve damage accumulates without noticeable symptoms. Approximately 96 million United States adults have prediabetes, and 80% are unaware of it. Early lifestyle modification has a higher reversal success rate than any available pharmaceutical intervention. Glaucoma causes irreversible optic nerve damage for years before peripheral vision loss becomes noticeable to the patient. By the time the deficit is apparent, substantial nerve tissue is already gone. Cervical cancer is detectable in pre-invasive stages through routine testing and treated with outpatient procedures at that stage. Invasive cervical cancer requires radical surgery, radiation, and chemotherapy. The financial and time cost of routine screening is categorically lower than the cost of treating what those screenings exist to intercept before it advances. 50. You turn the lights off and watch your phone or television in complete darkness because it feels more immersive, more relaxing, more like a proper wind down. What it is producing is a luminance contrast so extreme that your pupil is caught in a sustained conflict between the dark room telling it to dilate and the bright screen telling it to constrict. And this conflict generates the specific headache pattern, the eye strain, and the melatonin suppression that make dark room screen viewing measurably worse than the same screen in a lit room. Pupil size is regulated by the ratio of screen brightness to ambient room light. In a dark room, the pupil dilates to maximize light intake, then is forced to constrict by the bright screen. This creates sustained tension in the ciliary and iris sphincter muscles that generates the headache pattern associated with late-night dark room viewing. The eye's ability to manage high-contrast transitions depends on the luminance gradient between the target and its surround. Dark rooms eliminate surround luminance, forcing the retina to manage the full dynamic range of the screen without background support, dramatically increasing strain per minute of viewing. Melatonin suppression from screen light in a dark room is more pronounced than in a lit room. In a lit environment, ambient light partially competes with blue light influence on the suprachiasmatic nucleus. In complete darkness, the screen's blue light is the only light signal reaching the retina, exerting disproportionate circadian influence on melatonin timing. The solution has strong evidence and requires minimal effort. Bias lighting, a light strip placed behind the monitor or television, reduces the luminance contrast ratio substantially without meaningfully affecting viewing quality, and significantly reduces both eye strain severity and melatonin suppression intensity. This behavior is recognized by optometrists as a distinct presentation called dark room digital eye strain. You optimize your viewing environment for maximum eye strain and melatonin suppression at the same time, which is an impressive outcome for a habit designed around relaxation. 51. You fill every gap. Commute with a podcast, walk with headphones, wait in line on your phone. Work through every quiet moment because idle time feels like wasted time and you are a person who uses time well. What you are preventing is not idleness. You are preventing the default mode network from doing the maintenance work it exists to perform, and you have been preventing it consistently, possibly for years. The default mode network is a set of interconnected brain regions, including the medial prefrontal cortex, posterior cingulate, and angular gyrus, most active during unstructured rest and mind wandering. It is associated with autobiographical memory integration, perspective taking, creative insight, emotional processing, and the construction of self-narrative. It is suppressed during active task engagement, and it is suppressed by continuous input consumption. A 2009 study in Science found that a significant proportion of creative insights and problem-solving breakthroughs occur during periods of unstructured rest following an unsolved problem, not during focused effort. This is the neurological basis for the insight you get in the shower, and it requires the shower to not have a podcast playing. Memory consolidation, the transfer of information from short-term hippocampal storage to long-term cortical memory, occurs during wakeful rest. Filling rest periods with new input interferes with consolidation and reduces the net retention of information you have already encountered. Research by Mary Helen Imordino Yang at the University of Southern California demonstrated that DMN activity during rest is directly associated with emotional processing, empathy development, and moral reasoning. Attention restoration theory demonstrates that undemanded experience, a quiet walk, sitting outside without audio, restores directed attention capacity more effectively than structured relaxation activities. The creativity, emotional regulation, and memory consolidation that were supposed to happen in your quiet gaps have been waiting for you to stop filling them. That's 51. One of them was you, and you know which one. If you want to see more, click the video on screen now